The implantation technique, in which natural hairs or artificial fibers are inserted in the scalp, was developed during the years 1965 to 1970 in Japan, where it achieved considerable success within the health sector. Unfortunately, the imprudent application of this method by unqualified implantologists using incorrect techniques and unsuitable materials caused considerable damage and led the Food and Drug Administration to ban it in the United States only in June 1983, until new methodologies brought more satisfactory results. However, in Europe, the great interest in this methodology has stimulated intensive, painstaking scientific research. During the last 10 years, the perfection of the surgical technique, the continuous studies on more suitable biomaterials for implantation, and the wealth of medical and scientific information accumulated have clearly shown that optimum results can only be achieved if the protocol outlined below is complied with. Suitable fiber to Food and Drug Administration and European Community norms, optimum implantation instruments, screening of patients, skilled healthcare staff, pre-operative care, correct implantation technique, post-operative care. The implanter is the body of the instrument which contains the needle. Implantation fibers are packaged on a special support, which runs through their knots to keep them properly aligned. When the support is removed, the knob remains open, making connection easier. The fibers are similar in all respects to natural hair. Optimum results will only be achieved if suitable patients are selected, healthy individuals who can be relied on to carry out follow-up treatments and undergo the necessary health checks. Implantation must always be considered a medical technique. The fiber compatibility test is recommended at least 1 month before implantation. The patient's hair is washed with a shampoo at physiological pH. After this treatment, the patient is instructed to lie on a couch in a sterile environment. The doctor administers a light sedative to the patient. He administers local anesthetic in order to cut off the implantation area by injecting 2% carbocaine or xylocaine with adrenaline. After this preparation, the skin is ready for implantation. To obtain the best results, proceed as follows. The hair must be hooked and inserted in the scalp, holding it deep down with the needle until it has been removed from its sachet. The knot must not close completely, so that fibroblasts and connective fibers can grow around and through it, securing the artificial hair to the surrounding connective tissue. Never implant more than 500 hairs per session, placing them at least 2 to 3 millimeters apart, positioning the knot in the galea at an angle of about 45 degrees, so that the hair lies in the same direction as the nearby natural hairs, or as appropriate to the zone. Never implant 2 or more hairs in the same hole. Wait at least 20 days between sessions. When implantation is complete, cleanse the scalp, apply an ice pack for at least 5 to 10 minutes. Wash the hair with almost cold water and a medical shampoo. Comb the hair gently and dry with lukewarm air. Post-operative care is of vital importance for the success of the implantation. The patient must be properly informed about the most suitable products for use and must avoid substances which may cause deterioration of the implanted hair. Medical checks must be carried out regularly, at least every 2 months, and will also include the removal of any sebum plugs responsible for irritation as well as the loss of implanted hairs. Infection or inflammation may occur due to poor disinfection during implantation, unsuitable local conditions, inadequate scalp hygiene, or failure to carry out the post-operative checks. Reactions to chemicals are due to the use of irritating or aggressive substances. as well as following infection or inflammation, implanted hair is lost if the knot comes undone, if the fibre has not been implanted in the gallia capitis, if more than one hair is implanted in one hole, if plugs of sebum form. The aim of this paper is to demonstrate that nowadays the implantation of prosthetic fibres into the human scalp is a valid surgical technique. Since the latest system for anchoring the fibres allows it to be removed if necessary without trauma or lasting scars, the patient has an additional motive for desiring the benefits implantation is expected to provide.